Good morning, everyone, and welcome to today's session. I'm excited to introduce our topic, scenario-based MCQs for Prometric. Today, we'll focus on quick-answer scenario-based multiple-choice questions specifically tailored for nurses. We'll explore how these questions work, discuss some practical examples, and share tips to help you prepare effectively. Let's get started and make this session both informative and engaging. Let's take a closer look at the scenario explanation, specifically focusing on the first action we should take when suspecting a SDEMI. When we encounter a patient with symptoms suggestive of a ST elevation myocardial infarction, or SDEMI, the first crucial step is to act quickly and efficiently. This means initiating the initial assessment promptly, which includes checking their vital signs and confirming their symptoms. It's vital to gather as much information as possible, like the nature of their chest pain, its onset, duration, and any associated symptoms such as sweating or shortness of breath. The goal here is to recognize the signs early, so we can move quickly into the next phases of treatment, which are essential for improving outcomes. Remember, time is muscle in these situations. So, the key takeaway from this slide is that the first action in suspected SDEMI is to perform a rapid assessment, confirm the suspicion with an electrocardiogram, and be prepared to act immediately. This step sets the foundation for effective intervention and can make a significant difference in patient survival and recovery. When a patient presents with chest pain and SD elevation on the ECG, our first priority is to act quickly and effectively. The most important initial step is to give aspirin. Aspirin helps reduce mortality by preventing further clot formation in the coronary arteries, which is critical in acute coronary syndromes. Next, we need to establish IV access promptly to prepare for any necessary medications or interventions. Administering morphine can help alleviate severe chest pain and reduce anxiety, but it's important to remember that aspirin should be given first because of its proven benefit in reducing mortality. Calling a code blue is reserved for cardiac arrest situations, so in this scenario, it's not our immediate first step. Overall, the key point here is that giving aspirin immediately is crucial because it's been shown to improve survival in patients experiencing a heart attack. This step, combined with establishing IV access and providing appropriate pain relief, forms the foundation of initial management. Aspirin plays a crucial role in managing acute coronary syndrome because it actually helps reduce mortality. When a patient presents with symptoms, giving immediate antiplatelet therapy is essential. This helps to limit thrombus formation, which is the main cause of ongoing heart damage. It's important to administer aspirin as early as possible, ideally right away, unless there's a specific contraindication. Delaying treatment can make a big difference in patient outcomes. After giving aspirin, other interventions like establishing IV access or administering morphine can be carried out. But the key takeaway here is why aspirin is the first action, because it acts swiftly to prevent clot growth, which is critical in saving heart tissue and improving survival chances. That's why, in the overall management of acute coronary syndrome, aspirin is the initial and most important step.